Students, what we're going to discuss now are the microvascular complications associated with retinopathy. Okay? Remember, our microvascular complications dealt with problems on the capillary level. Now, you might have to remember, what's the retina? Retinopathy? Well, we know pathy is disease, but what's the retina? Well, the retina here is the inner layer of the eye that has the rods and the cones. The cones are for color, the rods for dark vision, if you will. Now, so that's the retina. Now, retinopathy can come in two different categories. One, non-proliferative, the other proliferative. Non-proliferative, the other proliferative. Okay, now, in non-proliferative retinopathy, what we have here, the patient will present with tiny hemorrhages, aneurysms, exudates, which means escapes, if you will, of tiny lipids and proteins in the eye, and also vein changes. One of the important things that can occur with non-proliferative retinopathy is what they call cotton wool spots. Cotton wool spots. And what causes them? Infarcted nerve fibers. Basically, infarcted means death. Okay? So that's non-proliferative retinopathy. Okay, now let's go over to proliferative. Proliferative means growth, and in this case it means the growth of too many capillaries. Too many capillaries. Where? Well, the growth will be on the retina, it'll be on the optic disc, otherwise known as the blind spot, or in the vitreous body itself. You say, wait a minute, what do you mean by vitreous body? Well, think of your eye with two chambers or two swimming pools. Maybe like a spa and the main pool. Well, the main pool we're going to call the vitreous body, which is a clear gel. Irreplaceable, by the way. The vitreous body, a clear gel, the posterior back part of the eye. So the capillaries branch out into the vitreous body, and then we have some real trouble. We can start a downward pathological spiral. What happens in the vitreous body? These capillaries burst and they bleed. What's the outcome? Temporary loss of vision due to blood present. Fortunately, this is supposed to be temporary, and the blood is reabsorbed and the vision returned. So we're happy about that. However, there is some scarring from the event. And what's the problem with the scars? In this case, scars can put pressure on the retina and can put the patient at risk for another problem called retinal detachment. Like a piece of tape just coming off a surface. Retinal detachment. Okay, now, a couple other things about retinopathy in the diabetic. Now, diabetes mellitus is the #1 cause of blindness for the age group 25 to 74 years old. We want to prevent that. Also, the diabetics are at greater risk for glaucoma and cataracts. Now, with this in mind, there's a couple things we're going to have to keep into play here. The diabetic must, notice the glasses there, watch for what? Well, they have to watch for signs and symptoms that may indicate a very serious problem. They may see spots, otherwise called floaters, in their visual field. Okay? Or they may see cobwebs. Or they may have sudden visual changes. Either or, they need to contact the doctor right away. Okay. Now, there can be problems that the patient is unaware that they're having visual or retinal damage. That's why the patient, diabetics, should have eye exams once every year. Once every year. Hypertension is you want to keep under control because that can significantly affect or trigger, if you will, retinopathy. And then early treatment, early laser treatment for macular edema. Now, I want us to talk a little bit about macular edema. Okay, macular edema, loss of central vision. For instance, you can see perfectly well that person. But the person with macular edema, what they'll see is they'll have intact peripheral vision, but their central vision is lost. And this can occur both with proliferative and non-proliferative retinopathy. May I add also, the patient may have both non-proliferative and proliferative retinopathy at the same time. There you have it, and that is our discussion on diabetes complications, microvascular retinopathy. Thanks for listening.